COPD triggers and how to avoid them. Common COPD triggers. Chronic obstructive pulmonary disease, COPD, is a condition that limits the flow of air in and out of the lungs. Symptoms include shortness of breath, coughing, wheezing, fatigue. Certain actions or substances can cause COPD symptoms to worsen or flare up. To manage COPD, it's important to avoid or limit exposure to known triggers. COPD trigger. Weather. Temperature and weather can cause COPD symptoms to worsen. Cold, dry air or hot air can trigger a flare-up. According to a study, temperature extremes, below freezing and above 90 degrees Fahrenheit, 32 degrees Celsius, are particularly dangerous. Add in other factors, such as wind and humidity, and the risk of a COPD flare-up increases. Managing cold weather. In cold, windy weather, you should cover your nose and mouth while outdoors. A painter's mask or scarf works well, or you can simply cup both hands together and hold them over your nose and mouth. Indoors, air humidity ideally should be at 40%. You can maintain this percentage with a humidifier. Managing hot weather. On extremely hot and humid days, there's no better way to avoid a COPD flare-up than to stay indoors with the air conditioner on, according to the National Emphysema Foundation. In fact, it's the only way to reduce the risk. Many people who have mid to late stage COPD will even move to a part of the country where weather temperatures are more moderate. COPD trigger, air pollution. Whether outdoors or indoors, air pollution can irritate the lungs and cause COPD symptoms to suddenly flare up. Outdoors, these allergens all spell trouble: dust, pollen, smog. Other common outdoor allergens include odors from industrial plants or road construction, smoke from outdoor fires. Indoors, the COPD Foundation recommends watching out for these allergens: dust, pollen, pet dander, chemicals from cleaning products, paint, or textiles. Smoke from fireplaces or cooking, mold, perfumes. Managing outdoor air pollution. People with COPD can protect themselves from outdoor pollutants much like they do in cold air. A painter's mask is recommended if you have to be outside. If you do have to be outside, limit your exercise or physical activity. The best way to reduce the risk of a flare-up is to remain indoors, especially when smog levels are particularly high. Some limited data suggests that high levels of ozone in the air may lead to COPD flare-ups. Generally, ozone levels are highest between May and September, and tend to be higher in the afternoon than in the morning. Managing indoor air pollution. An air purifier can help filter many harmful irritants out of the air. For a more natural option, several plants can help clean the air. Regular and thorough cleaning of your house, especially dusting and vacuuming, also can help reduce the risk of a COPD flare-up. However, it's best if someone other than the person with COPD does the cleaning. Chemicals in cleaning products can trigger symptoms, and so can dust that gets kicked up in the cleaning process. You may want to use natural cleaning products that don't have as many harmful irritants. Additionally, the exertion itself may cause a flare-up. COPD trigger, infections. Infections that affect the lungs and airways are dangerous for a person with COPD. Common bugs that cause colds and the flu can exacerbate COPD symptoms, such as coughing, wheezing, shortness of breath, fatigue. If not treated properly, they can also lead to pneumonia, which can be life-threatening. Avoiding infections. The easiest ways to reduce your risk of infection is to wash your hands often and thoroughly, and to make sure you stay up to date on recommended vaccinations, especially for the flu and pneumonia. The Cleveland Clinic also recommends that you stay hydrated, practice good hygiene, keep your home sanitized, avoid crowded places and people who are sick to reduce your risk of getting an infection. If you do get a cold or the flu, it's important to treat it as soon as possible. COPD trigger, cigarette smoke. The dangers of smoking have been vastly researched and documented. The risks to a person with COPD are numerous. Cigarette smoke contains tar and many toxic chemicals that irritate the lungs. Smoking also damages the cilia, the tiny hairs responsible for cleaning the airways. These factors can increase the risk of infection and a flare-up of symptoms. Avoiding cigarette smoke. No one should smoke, but this is especially true for people with COPD. If you have COPD, you should quit immediately. If you have already quit, you should do everything possible to stay smoke-free and to avoid secondhand smoke. There are many smoking cessation options available. Talk to your doctor about which ones are safe for you. More COPD resources. Managing or avoiding your triggers is the best first step to easing COPD symptoms. But sometimes that isn't enough. Here are some resources to help manage COPD. COPD drugs and medications. Alternative treatments for COPD. Doctors who treat COPD.